The member for Goldstein.
My question is to the Minister for Health. I refer the minister to media reports that show South Australia and the great state of Victoria are facing summer blackouts and major power outages. Why is energy reliability and affordability essential to healthcare services across Australia, and is the minister aware of any risks to delivering these vital and important services?
The Minister for Health.
Thank you very much, Mr Speaker. You know, Labor are electricity vandals and Labor are hospital vandals. Now, I look by comparison at the member for Goldstein, who spent many years advocating for lower electricity prices and helping to design policies such as the abolition of the carbon tax, which have delivered lower electricity prices. The member for Goldstein, who has done such a tremendous job in supporting new health services in his area, such as the new Holmes Glen 160-bed hospital. But one of the things he remarked on to me at the opening of the new Holmes Glen hospital is that hospitals like this cannot run unless they can afford the electricity through which to provide vital services. And we know in South Australia, South Australian Labor deliberately drove the Northern Power Station out of operation. They didn't just drive it out of operation. They made sure that it was physically blown up. Physically blown up. And you know what? You know what? In so doing, they destroyed the resilience of the South Australian system to the inevitable challenges that come. And so what occurred? What did we see in terms of the impact of this South Australian system on health services in South Australia? Let me quote from the ABC's headline. Embryos, I want you to listen to this.
Members on my left.
Embryos destroyed at Flinders Medical Centre.
The Minister for Health will resume his seat. The Minister for Health will resume his seat. I've warned the member for Kingston. She's interjecting completely uncontrollably. She will leave the chamber under 94A. Minister for Health has the call.
And so not only did we have that catastrophic outcome, a human outcome, an electricity outcome, an outcome for families, but now you would think that in Victoria they would have learnt the lessons, but instead Victorian Labor deliberately drove 1,600 megawatts of electricity baseload out of the system. And right now Victorian hospitals are paying the price. And the member for Bendigo likes to chat from time to time. The Bendigo Advertiser of the 25th of August. Central Victorian hospitals balking at rising power costs. Castlemaine Health has raised its concerns about the rising cost of energy with the state government, which has been criticised for failing to account for soaring power prices. What we are seeing is that Victoria's hospitals are now facing the same risk as South Australia's hospitals. And all of that at a time when the Leader of the Opposition at the federal level is proposing to double down and introduce a massive new electricity price hike. So they want to increase prices. We've taken steps to reduce them. The Prime Minister has a national energy plan to reduce pressure on gas, reduce pressure on retail, and to ensure that we have storage through Snowy 2.0. We want to keep the lights on.
Minister's time has concluded.